nurses, anybody who has a license regardless of their department. And the bright green is for environmental services advisory, and the yellow looking is for rehab. Thank you.
There's people in there already. Yeah, there's 2 people still in there, so whether they just got here or haven't left yet, I couldn't find a nurse to find out. So let's check that one a little bit later. I did check the judge just moved her out after the okay?
What room is that?
No, that room. I'm hungry already, darn it. I lost my pen. I do have that pen, but I don't have Well, no, I guess not. Darnell's was here, but have a seat. You'll find another one.
Sorry for not
Okay, hello. Good afternoon. So I have 3 subjects today. You can tell me what order you want these subjects in, okay? So the first one is stress. I have a really good video about relief of stress and stress relief and how to handle it since we're under just a little bit of stress these days. One of our patients is listening to us. Okay, good. Oh, good. Hi, Barb. And so then also health insurance. And the change, our health insurance renewals are up for June 1st. And so I was going to show you 2 different, we have some options. And I need your input on the options.
So get one of each, correct? Stress is going to make me do better. One of each, is that right?
Yes, one of each. Why don't you just hand them all, give them a stack over here and a stack over there, and they'll figure it out. Oh, no?
No.
They won't figure it out?
No. But we're spent. We have everybody's turn.
What's that? No, they don't have that. And then, of course, last but not least, we'll do our COVID-19 update as usual. Don't leave that out. That's right. of health insurance first, raise your hand.
Go for it.
That's the boring one. Get the boring one out of the way. All right, here we go. So, health insurance. Most everybody in here has one of two plans for health insurance. They either have this plan called the 5302 plan, or they have this plan called the Blue Care HMO Plan 48. All right, so everybody who has health insurance has one of these two plans. We have very few people signed up for the upper end of the plans. I don't even have the upper end of the plans, so I don't even know who they are. But some people have them, I don't. Anyway, we can go over that later because I think there's 3 people in the whole building that have it. So this is the most popular plan. So this is, we shopped our health insurance. We went out into the marketplace. Because our average age for our workforce is higher than the average age in other skilled nursing facilities, I think it means we're better. With age comes wisdom. Absolutely, that's exactly right. And we like that. That means we have longevity. Do you know what our employee turnover is right now? It's at 39%. That is unheard of for a skilled nursing facility. The statewide average, do you know what that is? It's around 120%. 120%. You know why? Because the same group turns over and over and over. A lot of them have the same core, but a same group turns over and over and over a lot. But we don't even have that. So we just have 39%. That's good. But also, the longer you stay at a place, guess what? Every year, we get a little older.
I don't know what you're talking about.
I don't know what you're talking about.
When I was 26.
I am 29 and holding for the last, not saying. That's right. For a long time. Almost as long as I'm 29. All right. Anyway, so because of that, we went out to Aetna, we went to Cigna, we went to United Healthcare. The only one that would actually bid on us was United Healthcare, and they bid a lot more than Blue Cross Blue Shield did again. So Blue Cross Blue Shield is who we've had all along. I think we've been relatively happy with them. I hope so, because we don't have a whole lot of choice. But I think we have been pretty happy with them, relatively. So this is what our current plan is right now. This is the renewal proposal. Now I actually, and don't get sticker shock down here, because I put down here my cost. This is my cost for health insurance, not yours. So yours costs $55. For me, it's $476. So it's a little bit of a difference. So that's how much I pay for your health insurance for everybody who signs up, every person. So the renewal option goes up from $476 to $516. So that's an extra $40 a month. And if we do the alternate, it goes from $476 to $502. I know you guys want to look at dollars first. That doesn't mean I'm going to pass it all along to you, but that doesn't mean an increase. So that's probably a $10 increase for this one and a $15 increase for this one to you guys. That means the current plan under this one will go from 55 to 65 or from 55 to 70 pay period. Okay? So let's scroll to the top and see what the differences are. So this, from here to here, is exactly the same plan. The same plan we have this year is the same we planned. Now, a pain point that we've had has been the deductible. The deductible is very high. It is $5,000. That's a lot. But you don't encounter the deductible if you're only going to the doctor's office. And with this one, there is now coverage for virtual visits. Before in network, as long as you stayed in network, you did pretty good. Primary care was a $30 copay. Specialist is a $50 copay. That doesn't dip into the deductible. It's included in your out-of-pocket max, but these copays you don't have to pay anymore. The problem, lab work is covered 100%, no matter what it is. diagnostic tests and x-rays. This is where we've had problems. And I have been able to negotiate private pay rates with our physicians, with MIT and with Sand Lake, so that we can pay them directly and pay them less. For those of you who have needed MRIs or CT scans or any kind of x-rays. But they're more than likely, you're going to have to do a whole lot of x-rays and MRIs in order to get to that $5,000 deductible. So if you do have one of those scheduled, then you are going to end up having to pay for it out of pocket. The alternate plan, the one right here, I don't necessarily like. I'll tell you that up front, because I don't think it gives us much more value for much less money. So it goes from $5,000 deductible to $5,500 deductible. Out of pocket goes up. Primary care physician goes from 30 to 50. Specialist goes from 55 to 75. So it takes a lot out of your pocket. And I think that extra $5 a pay period, you'll be able to make it up. You won't have to go to here, 60 to 80. But I put them in your hands, so I'm going to need feedback from you guys as to what you want us to do.
Do we have any more? We didn't get any.
We're working on them. They have to, she had to make copies for them.
Oh, I'm sorry. Did I only pick half of them up off the copier? I probably did. Okay. So this is option number 2. So the other half of you have this option. Can you guys see that?
Very small.
That's better.
Is that better? Okay. All right, so here again, this one, let's go down to the bottom. So right now, you guys are paying, tell me please, $74 a pay period for this plan right here. And it's going from $527 to $568. Now, if we do the alternate plan, it goes down, actually, so your cost will also go down. But
everything else goes up.
But everything else goes up, exactly. So 527 to 568 is about another, what, $40 more. So your cost would go up about $15 also on this one. So, of course, with the renewal from here to here, it's exactly the same. The $2,000, I should have put the other part here. But the $2,000 deductible for individual, $6,000 for family, $5,500 individual, max out of pocket. Doctor's visits, this is the virtual doctor's visit, is $10, still $35. So this is the alternate, but the deductible goes up again from $2,000 to $5,000. And I think that's a lot. The copay goes from 10 to 10, 35 to 40, 65 to 65. And on this one, your X-ray has only a copay. X-ray and then advanced MRIs and CTs have a copay. So $50 for an X-ray and $300 for an MRI and a CT. So that's a little bit better coverage in that you don't have to negotiate. Now, I'm not sure that an X-ray is going to cost you more than $50 though. I know for a fact that a chest X-ray is going to cost you $50 whether it's private pay or whether it's with insurance. A CT scan is going to cost you less than $300. Wait, so it's almost, and I don't know if you guys are, she didn't get anything. Miss Costello. But I don't know if you guys are aware that when you do have advanced imaging, like a CT scan or an MRI, many times it's cheaper without the insurance. So you ask them, what is the private pay cost first? Don't tell them you have insurance. Because then then you'll end up paying the $300 copay and find out that CT scan you could have gotten for $120.
I had an MRI, it was almost $800 without insurance, it was $214.
See that? MRI, that's a prime example. I did the same thing with a CT scan. Yeah, and an abdominal ultrasound. Oh.
And they didn't tell me so much.
Anyway. Alrighty, so this right here is the urgent care, $70 copay to $85 copay for urgent care. Emergency room is $300, and then this is all hospital inpatient. This is deductible, and then 20%, that's deductible, and 30%. So I'm going to let you guys stew on this for a while and hold these pieces of paper for the next week, and then you let me know which direction we feel like we should go. Okay? The best and the cheapest. All right. There it is. All right, so now that I've stressed you guys all out with insurance. Yes, it's very good. Dental and vision is very good. I'm going to put that on there. But dental and vision, there is no price increase for dental and vision, and it's the exact same as it was last year.
The vision you can go to Sam's, right?
I don't know.
Sam's, Walmart.
When I had United Healthcare, most offices, doctors were not giving up.
Is they coming back in to renew the vision?
Yes.
Okay.
They paid for the operation, but they would not pay for the implants.
It depends on the insurance company. Now, that was United. Blue Cross is actually better than United is. But we're not doing United. We're going with Florida Blue. But the insurance, they will be in to come in with renewal. They will also have, we are not going with Colonial again. Colonial really messed up employee everything. Yes. So we're not going with Colonial anymore. It's a company called Principal, and they have essentially the same policies. I did my research. I looked up all of their, other companies that have them, and they all have good things to say about them, which I can't say anything good about Colonial. So I think we're going to try them. All right. And so next month you'll see open enrollment, and they'll be here for about 10 days, like they did last year. And they have to see every employee, all 3 shifts. They'll be here night and day, on the porch. On the porch, night and day.
Put a tent.
What's that?
Put a tent outside.
You're going to put a tent out there, that's right. Our open enrollment tent will be outside. So we don't let them in our airspace. We got to protect our airspace. All right, let's see. What we got here?
I have a confession. But first, I want you to make a little confession to me. In the past year, I want you to just raise your hand if you've experienced relatively little stress. Anyone? How about a moderate amount of stress? Who's experienced a lot of stress? Yeah, me too. But that is not my confession. My confession is this: I'm a health psychologist, and my mission is to help people be happier and healthier. But I fear that something I've been teaching for the last 10 years is doing more harm than good, and it has to do with stress. For years, I've been telling people stress makes you sick. It increases the risk of everything from the common cold to cardiovascular disease. Basically, I've turned stress into the enemy. But I've changed my mind about stress. And today, I want to change yours. Let me start with the study that made me rethink my whole approach to stress. This study tracked 30,000 adults in the United States for 8 years. And they started by asking people, how much stress have you experienced in the last year? They also asked, do you believe that stress is harmful for your health? And then they used public death records to find out who died. Okay, some bad news first. People who experienced a lot of stress in the previous year had a 43% increased risk of dying. But that was only true for the people people who also believed that stress is harmful for your health. People who experienced a lot of stress but did not view stress as harmful were no more likely to die. In fact, they had the lowest risk of dying of anyone in the study, including people who had relatively little stress. Now, the researchers estimated that over the 8 years they were tracking deaths, 182,000 Americans died prematurely, not from stress, but from the belief that stress is bad for you. That is over 20,000 deaths a year. Now, if that estimate is correct, that would make believing stress is bad for you the 15th largest cause of death in the United States last year, killing more people than skin cancer, HIV, AIDS, and homicide. You can see why this study freaked me out. Here I've been spending so much energy telling people stress is bad for your health. So this study got me wondering, can changing how you think about stress make you healthier? And here the science says yes. When you change your mind about stress, you can change your body's response to stress. Now, to explain how this works, I want you all to pretend that you are participants in a study designed to stress you out. It's called the social stress test. You come into the laboratory and you're told you have to give a 5-minute impromptu speech on your personal weaknesses to a panel of expert evaluators sitting right in front of you. And to make sure you feel the pressure, there are bright lights and a camera in your face, kind of like this. And the evaluators have been trained to give you discouraging nonverbal feedback, like this. Now that you're sufficiently demoralized, time for part 2, a math test. And unbeknownst to you, the experimenter has been trained to harass you during it. Now, we're gonna all do this together. It's gonna be fun, for me. Okay. I want you all to count backwards from 996 in increments of 7. You're gonna do this out loud, as fast as you can, starting with 996. Go. Go faster. Faster, please. You're going too slow. Stop, 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 stop. That guy made a mistake. We're gonna have to start all over again. You're not very good at this, are you? Okay, so you get the idea. Now, if you were actually in this study, you'd probably be a little stressed out. Your heart might be pounding, you might be breathing faster, maybe breaking out into a sweat. And normally we interpret these physical changes as anxiety or signs that we aren't coping very well with the pressure. But what if you viewed them instead as signs that your body was energized, was preparing you to meet this challenge? Now that is exactly what participants were told in a study conducted at Harvard University. Before they went through the social stress test, they were taught to rethink their stress response as helpful. That pounding heart is preparing you for action. If you're breathing faster, it's no problem. It's getting more oxygen to your brain. And participants who learned to view the stress response as helpful for their performance, well, they were less stressed out, less anxious, more confident. But the most fascinating finding to me was how their physical stress response changed. Now, in a typical stress response, your heart rate goes up and your blood vessels constrict like this. And this is one of the reasons that chronic stress is sometimes associated with cardiovascular disease. It's not really healthy to be in this state all the time. But in the study, when participants viewed their stress response as helpful, their blood vessels stayed relaxed like this. Their heart was still pounding, but this is a much healthier cardiovascular profile. It actually looks a lot like what happens in moments of joy and courage. Over a lifetime of stressful experiences, this one biological change could be the difference between a stress-induced heart attack at age 50 and living well into your 90s. And this is really what the new science of stress reveals, that how you think about stress matters. So my goal as a health psychologist has changed. I no longer want to get rid of your stress. I want to make you better at stress. And we just did a little intervention. If you raise raised your hand and said you had a lot of stress in the last year, we could have saved your life. Because hopefully the next time your heart is pounding from stress, you're going to remember this talk, and you're going to think to yourself, this is my body helping me rise to this challenge. And when you view stress in that way, your body believes you, and your stress response becomes healthier. Now, I said I had over a decade of demonizing stress to redeem myself from. So we are going to do one more intervention. I want to tell you about one of the most underappreciated aspects of the stress response. And the idea is this: stress makes you social. To understand the side of stress, we need to talk about a hormone, oxytocin. And I know oxytocin has already gotten as much hype as a hormone can get. It even has its own cute nickname, the cuddle hormone, because it's released when you hug someone. But this is a very small part of what oxytocin is involved in. Oxytocin is a neurohormone. It fine-tunes your brain's social instincts. It primes you to do things that strengthen close relationships. Oxytocin makes you crave physical contact with your friends and family. It enhances your empathy. It even makes you more willing to help and support the people you care about. Some people have even suggested we should snort oxytocin to become more compassionate and caring. But here's what most people don't understand about oxytocin. It's a stress hormone. Your pituitary gland pumps this stuff out as part of the stress response. It's as much a part of your stress response as the adrenaline that makes your heart pound. And when oxytocin is released in the stress response, it is motivating you to seek support. Your biological stress response is nudging you to tell someone how you feel instead of bottling it up. Your stress response wants to make sure you notice when someone else in your life is struggling so that you can support each other. When life is difficult, your stress response wants you to be surrounded by people who care about you. Okay, so how is knowing this side of stress going to make you healthier? Well, oxytocin doesn't only act on your brain, it also acts on your body. And one of its main roles in your body is to protect your cardiovascular system from the effects of stress. It's a natural anti-inflammatory. It also helps your blood vessels stay relaxed during stress. But my favorite effect on the body is actually on the heart. Your heart has receptors for this hormone. And oxytocin helps heart cells regenerate and heal from any stress-induced damage. This stress hormone strengthens your heart. And the cool thing is that all of these physical benefits of oxytocin are enhanced by social contact and social support. So when you reach out to others under stress, either to seek support or to help someone else, you release more of this hormone, your stress response becomes healthier, and you actually recover faster from stress. I find this amazing, that your stress response has a built-in mechanism for stress resilience. And that mechanism is human connection. I want to finish by telling you about one more study. And listen up, because this study could also save a life. This study tracked about 1,000 adults in the United States, and they ranged in age from 34 to 93. And they started the study by asking, how much stress have you experienced in the last year? They also asked, how much time have you spent helping out friends, neighbors, people in your community? And then they used public records for the next 5 years to find out who died. Okay, so the bad news first. For every major stressful life experience, like financial difficulties or family crisis, that increased the risk of dying by 30%. But, and I hope you are expecting a but by now, but that wasn't true for everyone. People who spent time caring for others showed absolutely no stress-related increase in dying, 0. Caring created resilience. And so we see once again that the harmful effects of stress on your health are not inevitable. How you think and how you act can transform your experience of stress. When you choose to view your stress response as helpful, you create the biology of courage. And when you choose to connect with others under stress, you can create resilience. Now, I wouldn't necessarily ask for more stressful experiences in my life, but this science has given me a whole new appreciation for stress. Stress gives us access to our hearts. The compassionate heart that finds joy and meaning in connecting with others. And yes, your pounding physical heart working so hard to give you strength and energy. And when you choose to view stress in this way, you're not just getting better at stress, you're actually making a pretty profound statement. You're saying that you can trust yourself to handle life's challenges. And you're remembering that you don't have to face them alone. Thank you. Thank you.
Okay. So what did we learn about stress? Why won't it kill you?
Because we care.
Because we care. Good. That's right. Because we care about others and take care of others, and that helps us to deal with stress.
Makes you stretch.
Makes you stretch. There you go. That's a good way of saying it. And resilient. Gives you courage, right? Able to tackle life's problems and issues and adversities, challenges, right?
Make you strong like bull.
Make you strong like bull. Okay. I like that. All right. So, what are we? COVID update. We are, and you will know if we get a COVID positive patient, and we do not have a COVID positive patient in the facility. We are getting our negatives from the hospitals before our patients admit. There are many facilities in the area. There are about 1,400 COVID positive patients in the state of Florida.
Yeah, a lot are exempt from actually advertising it too, aren't they?
So they are supposed to reveal, but there's no legislation that says that they have to. I think that's coming down the pike very, very shortly, though. Very, very shortly. We do have we got in our KN95 masks. We don't have N95, so we have KN95s, which is the Chinese version. And they are in my office and ready for just in case. We do have a contingency plan in case we have somebody that's positive. And of course, we all need to continue to wear our masks every day. Yes. The Florida curve is coming down a bit. Actually, it still has. I should have shown you, but let's see. I'll let you guys guide this one. What are any questions? This seems to be the new normal now, huh? My mask is part of my everyday
Life.
yes. My accessory, that's right. I told my husband today I got to figure out a hairstyle that goes with mask.
New earrings.
New earrings, that's right. Let's see, I don't know what that is. Okay, so these are, no, I want Florida Department of Health. I'll just go over here. You guys all know how to go to this website?
Right at
The Department of Health, Corona, see dashboard. This is what you want to look at, right here. You want this to come down the other side. The projections by the thinks that we are not going to peak until May 3rd, that this should still continue to climb. There's different schools of thought. We still have people thinking that it's because of our heat. There's a lot of the southern states are coming down and are stabilizing in their number of cases, that the weather is playing a huge role in bringing this down. I'm hoping that's the case, and also that we're being extra vigilant with our social distancing and our cleaning, and that all our efforts are working. Because as you can see, it went up, 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 and the projections thought it was going to continue to go up, but it did not. It started coming back down. Let's see this. So here, I don't know, I have it on South Dakota. Oh, I do know why I have it on South Dakota. South Dakota is where the meat packing plant is that has the now 220 cases.
That was like Smithfield, wasn't it?
That's Smithfield.
I know, when I used
Are you from South Dakota?
No.
Oh.
We were just talking.
Yes. So here's the projection. So hospital resource use. And this is how many beds they think we're going to need, and this is how many beds we have. So it's only like a third of the beds or something, or even a quarter now. 4,000 beds are needed, and we have 20,000 beds in the state. So the surge is not going to take up all our beds. We also have enough ICU beds. This is the number of ICU beds they need and how many we have. So we, even at the peak of the surge of what they think is going to occur. This is their projection for Florida. As you can see, right here, they were projecting it goes up and over like this. We are flattening the curve very, very nicely. Very, very nicely. So we need to all keep doing what we're doing. Healthcare workers now they have time at Publix to go shopping. I believe it's tonight, 8 to 9, and tomorrow morning, 7 to 8 for healthcare workers, if you need toilet paper. Thank you, Carrie.
Go in the morning if you need toilet paper.
No, I'll give you back the toilet paper. All right, also Dollar General's giving 10% off to healthcare workers. There's some places that are giving free oil changes to healthcare workers. So when you go, just ask. Let them know, hey, I'm a healthcare worker. See what you get. Wear your scrubs into the grocery store, they all move.
Yeah, they definitely.
Nobody is around you. All right.
Yeah, but they also give you that.
They get out of your way and then they look at you nasty.
Just remember, you're going to like this.
That's right, you're going to need this one day.
We know where to put ice packs and these.
All right. Anything else? Questions?
Money?
Money, hazard pay. Yes, we did get it. So we are going to wait until we have a hazard, if we have a hazard, and then I'm going to offer those employees that will take care of those patients more pay. And if we have it, and if not, then we'll distribute it. We'll have a committee distribute it at the end of everything that happens. All right, so the last of the Mohicans, everybody who's still with me at the end, there we go. I'm hoping this end will be soon, but I don't know. I have no predictions. I don't have my crystal ball out.
Hard to call.
Doesn't. No, Adam, does your crystal ball work?
I just want to say something about the hazard pay so you guys understand exactly how Debbie's doing it. I think it is based on the merit of how you believe you are a hero facing this particular situation. So just in case if we do get a COVID patient, and some people might want to jump ship, you do not deserve hazard pay for that.
Correct.
If you stay in place, do your job as a hero, remember, Oxy, whatever she called it, snort it before you get up in the morning, come to work, and do your job. Oxytocin. If you do not do your job, and you jump ship, you do not deserve hazard duty pay.
So hazard pay is you come to work every day talking to the patients, the families, and all.
Correct.
That's hazard pay.
That's right. We haven't been presented with any hazard right now.
So what about if we get sick during this hazard pay?
Whether you're here during the operation. as it was worse.
So I'm saying, what are y'all doing to protect us when we get sick?
We're doing everything that you do now is protecting you as we speak. We haven't accepted any patient that has
No, but
COVID-19.
you said that it was we take care of this. We are, as healthcare workers, always in their face, we always there.
If you continue to do your job, currently speaking, all of you will get hazard pay. That's how it works. At the end of the operation.
But you're saying until it's over with, nobody knows when it's over with, just wait till you.
Listen up, one more time. Listen up, listen up, listen up. This will make it easier for you to understand. When they open everything back up, all right, you're going to have some folks who are going to say, I don't want to deal with this. They're going to mic out. That's just normal. It's fight or flight reflex. Okay? If you have a good fight or flight reflex and you love your job, you love your position that you're in as a hero doing what you do now as a first line responder to this particular disease, she's going to reward you.
Adam, I think the concern is that if it was fast-tracked through Congress to get out there immediately, it was either for distribution immediately or to facilities that are facing a hazard.
You have other facilities doing the exact same way she's doing it. That's not how they're doing it. Because you have other places.
That is how other places in Orlando even
Yes,
are
they're
doing it.
stopping because people are, I want hazard pay, get it, and then they're gone.
Then they quit their
They
job.
quit their job, they're out. We got other folks who are going to New York to face this thing. They're stepping in the fray. You have to understand this is what it's about to be in healthcare. You're standing in the fray. Do your jobs consistently and to the best of your abilities, and we'll all be rewarded.
There's a question.
What's that?
What was that, Nita?
I can't hear you. Everyone that comes in this building, while Corona's outside, you are part of the mission. You are a hero. Regardless if you're washing clothes or you're mopping the floor. Okay? Everybody's part of the
You guys
mission.
are all protecting this airspace. That's what's so important. You're watching what you're doing. You're not going in groups because you've got to protect your patients here. That's why you're doing it. Not because you might not be scared of getting corona, but if you go around and hang out in a group and that group gives you, and you might be asymptomatic. You might pick it up, be asymptomatic, and be able to carry it in here to your patients. So we want to be sure that we protect our patients in this building. That is our #1 concern.
Because you're going to see a lot of that. You're going to see a lot of people, I don't want to do this, I'm out of here. And it stops rumor and innuendo too, folks. We have not had a COVID-19 patient here.
And as soon as we do, you will know.
Yeah, we're not going to hide it from you.
We're not going to hide it from anybody. We will be very upfront with it. And we have all the necessary supplies and equipment to take care of them in my office.
So we can suit up every time we go.
You can suit up every time you go in. That's right. And we will limit the number of people that go into the room. We are learning from other facilities that are currently dealing with COVID-19 patients where they are limiting the number of caregivers that go into the room. Most of the 1,300 that are in skilled nursing facilities right now in Florida, there are very few. There's like 20 or 30, I forget the exact number, but it's like 20 something or 30 something that have actually had to go back to the hospital. All of them have had rather mild symptoms, so they have recovered and gone home. So thank goodness for that. And all of them have been able to, most of them have been able to contain it. There's been a handful of facilities that were not able to contain it, and they ended up with a lot of patients with it.
And I just want to speak to the numbers again for you. A lot of people don't understand that the majority of the folks that catch this do recover. In Ocala, Florida, there's 57,000 people in the main city limits. We only have 13 actual people who are hospitalized with this particular virus. That is extremely, extremely low looking at the numbers. We're not like New York, we're not like San Francisco, we're not like Washington, but we do need to treat this very seriously. Okay? Keep doing the things that you're doing now, and we will make it to the end together. If you do not do that, you don't want to wear your mask, you want to smoke and joke, high five, or whatever the case may be in small groups, you're going to end up spreading something you don't want. So continue to follow Debbie and her guidelines and her direction, and I promise you, as a facility, we will keep everyone safe. When you're out doing your normal day-to-day operations, you're going to the grocery store, you're hanging out at the gas station, I see it. I try to go to the cheapest gas pump possible. When I get to the gas station, everybody's spread out. It's like roaches when you turn on the lights. Nobody's around each other. Don't let them reopening the country or relaxing any standards to you stop you from doing what you are doing. Our overall mission is to protect us as a family and our patients. So continue to do exactly what you are doing. You are doing the best. Okay? That is the best way I could possibly do it. Or say it to you. I've traveled to other facilities and not on par with what you guys are doing. We were way ahead of it. She had you wearing masks almost like 2 or 3 weeks before they said everybody has to put them on. Keep in mind, she has your best interest at heart. All right? That is how we beat this particular virus, and we keep everyone safe.
Is there questions about the masks? So we have 2 autoclaves actually in the back, and we are autoclaving masks. If you put your name on your mask and put it in the mask disposal, don't put it in the garbage, put it in the mask disposal that's in the back. You all have a cubby hole, and you all have memos that are in the cubby hole. We're going to start next week giving away prizes for those that find your find the cubby hole with the, that have some, that find it and come to Amanda first, because I want to get used to that being a means of communication with you guys with the cubby holes. So the masks, our aim is to get, you guys all need to have the ones that are lined and reusable. Or our aim is to have 2 for every employee. I still have seamstresses out there. They're still they're still sewing. They're still Mary Alice has her sewing machine here, so she can modify them if needed. If you need them smaller, you need them larger, whatever you need. But that's our aim, so that you can have 1 in the autoclave and 1 on your face all the time. Okay? All right. Thank you guys. Have a great afternoon.